Hello, thank you for joining the latest one-on-one episode, a video series from Modern Healthcare Custom Media featuring insights from leaders across the industry. I'm Maria Castellucci, a custom content strategist here at Modern Healthcare. On today's episode, it's my pleasure to be speaking with Leslie Basham, President and CEO of Surgical Directions. Leslie is passionate about partnering with healthcare organizations to improve the health and well-being of the communities they serve. During our conversation today, Leslie will be discussing the perfect storm facing hospitals and medical clinics today: major procedural staffing shortages and a high demand for surgery after 2 years of delays in care because of the pandemic. Leslie, thank you so much for being here today. I'm excited for our conversation.
Maria, thank you so much for having me. It's great to be here.
So, Leslie, let's dive in. Surgical Directions works with hospitals and health systems across the country. Can you offer a broad overview of what you're hearing from them from a staffing perspective? What challenges are they facing?
Absolutely. So you're right. Surgical Directions has worked with nearly 500 different healthcare clients and health systems to help improve their operational, organizational, financial performance, particularly in, as our name implies, surgical and procedural care. And we do that through consulting. We also have a tech product that helps to manage operational efficiency within the OR, and leadership staffing for OR directors, anesthesia leaders, et cetera. So we've seen a lot, and especially over these last few years, it has been such so much change in how hospitals have had to respond to the pandemic. And we work with some of the most prestigious academic medical centers in the country to some of the most rural health equity type areas with regional hospitals. And so, they're very different types of institutions, but they really are sharing similar problems. And the pandemic has put a tremendous amount of financial pressure. The postponement of elective surgeries back in the spring and summer of 2020, we're still seeing the backlog from that as people have sort of stepped out of care. And also, that has led to a tremendous amount of burnout. So, there's a nurse that works for our organization, and she was working in New Jersey, right, in March and April of 2020, when that was really the epicenter of COVID. And the pressures, she was talking about the pressures of working there, right, when no family and no support network could come and be a guest or be a visitor at the hospital. Those patients were alone and facing some of the most anxious moments of their life, facing death. And so to be that nurse who is not only trying to care for all this influx of patients, but also being that support network for those people, it just created a tremendous amount of mental pressure and burnout. And so the financial pressures of the hospital, coupled with the care delivery pressures, there's just been a huge amount of clinician staffing shortages. And that is by far what we're seeing across the board as the number one issue, I would say. And I think for the first time there was a study, financial recovery and financial stability has been the number one priority for hospitals for the last, 5 or so years. This is the first year in 2021 where people are saying, or 2022, where they're saying clinician shortages by far number one priority.
Yeah, I saw that too. So that was a great way to kind of set the stage of what hospitals and medical clinics are facing. Really, no matter what type of institution they are, they're facing this challenge. But let's also talk about solutions. So what advice for providers who are in this stressful situation of having high procedural demand but not enough staff? What should be their immediate first steps to fix this challenge?
That's a good question. And I want to applaud the health system. Everybody's working so hard to solve these problems. And there's a lot of different tactics that have been tried and are working. But this is really, it is a big issue, and it's not going away. It's not a temporary, let's just plug the gap for 3 months because then all the clinicians will come back. And so one of our physicians always says, how do you eat an elephant? One bite at a time. A little silly, but this is an elephant-sized problem. And so I like to deconstruct it into, more solvable pieces. And so if you think about it from a supply and demand perspective, where there is a pent up demand for surgical services. You had a shortage of supply of resources to be able to perform those services. And if you break it into those parts and then say, okay, well, what can we do to address that? And if you think about the supply side, a quicker win is how can you take what you currently have and make the most of it. So you have a certain number of ORs, you have a certain number of robots, you have a certain number of staff. And so how do you make the most of those resources without further burdening them, right? Don't make the same few people there do more and have greater stress, but how do you make it so that things run more smoothly and there's the right access? So things like first case on time starts, improving the turnaround time between procedures, improving the utilization of the ORs through case scheduling predictability. There's so many very innovative solutions out there and technologies that help to get more accurate case time, right? Each surgeon does, it could be the same type of case, but each surgeon does it differently. It takes a different amount of time. And there's enough smart solutions out there that can say, you know what, for this case in this room with this surgeon, it should take this long. And if you actually schedule your day that way, you're able to get more cases in with greater predictability. And that's such a clinician satisfier. When you're a nurse and you've just worked 10-hour shift, to know that you have to do 2 to 3 hours of overtime, even if you get paid for that, you want to get home to your kid's soccer game, right? Like you need some predictability in scheduling. And so that goes to a second tactic, right? Which is how do you retain the clinicians that you have? And so that's so important. Clinician turnover is very expensive. And right now there's a lot of people hiring travelers, and you have to plug that hole, hiring a traveler or a locum to fill that gap because you have to deliver surgery. But that sort of could create a wage inequity as well, because those people are typically paid a premium, which then creates inequity amongst your current staff. And so it sort of exacerbates the problem. And so how can you make sure that you are retaining your clinicians so that they stay and that you don't need as many travelers? And that is really focused on, a lot of people have taken different tactics, right? So the retention bonus or the hardship bonus was a very common tactic tied to keeping people, for the next 12 months. 12 years would be a luxury. But and different tactics like that and extra benefits and extra rewards have been have worked very well to help to keep those folks. And then lastly is thinking then about the demand for surgery. So how are you making sure that you are doing the right and appropriate care for certain people? And that was the reason why they did some postponement of elective surgery, but maybe some of those cases should move to an ambulatory care center or somewhere else to help right size the ORs. So that was a lot, Maria, to your question, but so how do you make ORs more, your current resources more efficient? Do all what you can in a holistic way to improve clinician retention, and then also looking at getting the right case in the right place to balance demand.
Yeah, so I wanted to touch on the second one, which is the retention of staff piece. So I've heard a lot about, frontline caregivers getting big bonuses, higher compensation during this time. Is that a good tactic?
Yeah, no, good question. So it is by far the most common tactic and the easiest tactic to see and immediately feel. We would be too idealistic if we said compensation doesn't matter, right? The compensation matters to everyone in every business. It's pretty much the number one reason people work across all industries, including in healthcare. The number two reason gets interesting. I think for physicians, last time I saw, the number two reason is the prestige of the job. How do you they get to be called doctor, and how do you increase the prestige? So yes, compensation is important, but it's the holistic view that really is important. And so, you've probably heard of Maslow's hierarchy of needs. There's a similar framework for employee engagement, right? Where the base of that pyramid of the hierarchy of needs is compensation, right? It matters, compensation, benefits, bonus. But after that, you really have to start thinking about the things that matter. And that's, training and professional development is a big area right now. Because of the shortage, a lot of nurses have had to cover other areas. If they always did ortho, now they're moving on to neurology, or they had to move to the ICU. And if you don't have training on those areas, if you don't really know what you're doing, when you're already burnt out and anxious, it creates even more anxiety. And so, the next step is, how are you really giving people the training and professional development that they need? And then as you keep moving up, a really big one is that community and connection. And that's particularly important in healthcare, where it's a team care model. And I think, it's just so important to know that I think people are more frequently, and there's a lot of studies on this too, that show that if you have your best friend at work, you are going to be more loyal to that organization. And people are more loyal to their care team or to their service line team than the institution. So how do you continue to create that sense of community and connection? Because then they won't want to leave each other. They're leaving their friend network. And if you go up the pyramid, appreciation is the next one, and status and all of that, which is, I touched on that. And the top thing that really matters and so important in healthcare is, passion and fulfillment. And you would think it'd be easy, right, to have fulfillment in taking care of patients in this day and age. Like, these people are, our healthcare providers are celebrities. They should be, right? They should be honored for everything that they've been doing over these last 2 years. But in the day-to-day of it, it's hard not to just get tired. And if the culture is tough, and, so how do you continually celebrate and create that passion for caregiving? And that's sort of been lost with all the administrative side of it and the regulatory side of it. And to get that passion back for providing excellent care for patients. And so, yes, compensation is important, but if you look at it in isolation, it's not going to work, right? It's got to be that full hierarchy of needs.
Yeah, that's an excellent point. It's really just the first step. So,
yeah.
Okay, so let's move on to you talked about some solutions, but let's talk about long-term solutions providers should be considering to ensure they have an adequate procedural staff going forward. What are some long-term solutions providers should be thinking about?
Yeah, then that's important. And so we always say, do as many quick wins as you can to help, but then always be building for the future. A lot of the institutions, the more innovative institutions that I've worked with over the last few months have been setting up their own sort of academic programming and education for, CRNA training within anesthesia, or certification programs, even for things like central sterile processing technicians or surgical techs. The staffing crisis is happening across the whole care continuum, right? And so how can hospitals become, some are already built that way, academic medical centers, but those that aren't, how do they create education and training programs so that those people coming through their facility, as you're trained through that facility, you create loyalty to that facility. It can help give you a pipeline to close some of those gaps, especially if they're quicker, certificate type programs. But also, clinicians love to teach, and people get reward out of teaching. So going back to that fulfillment and professional development, being a teacher also, as long as it's balanced with their other workload, can provide a great deal of gratitude and loyalty to the organization. So setting up that sort of pipeline and training development program is one thing that I've seen work well. It's a longer term solution, but it will be effective in helping to quell the shortage.
Okay, great. So I do want to touch on what should leaders not do. So is there a strategy you see in the industry that, they're trying to respond to these staffing challenges that simply doesn't work and you'd advise leaders against doing?
That's a good question. And there's many right answers. There's a few wrong answers, but I think it goes back to what I was talking about before. If you look at this myopically and just say, I'm going to give them a bonus. I gave them a bonus. Why aren't they staying? It's not just about compensation. And it is about the equity across the organization, particularly with this influx of travelers. And so how are you creating kind of structure around that compensation instead of just bringing in a bunch of travelers, and but looking at it beyond compensation, right? This is a much bigger systemic thing, you know. And I'll one other area that's been I was at one of my children had a birthday party this weekend, and I talked to two nurses who have stepped out because of the burnout, but they also had just had babies. You know, there's a parental leave and a maternity leave. You know, if you work in a corporate world or a big tech company, you get lots and lots of maternity leave, and much less in healthcare. And so, you know, should that be relooked at, for example, because then maybe those new moms would come back if they had enough time to recover after giving birth. And so there's, I think the whole system needs to be relooked at with the, you know, have nurses help build the nurse compensation plan, have physicians help build the physician compensation plan. This does not and should not be built in a black box. So.
Right. Okay, well, wonderful. So any final thoughts? We discussed a lot. Do you have any final thoughts before we wrap up here? It's been great speaking with you.
Yeah, Maria, it has been. I would just say that I think, you know, I want to say thank you to all our healthcare administrators and clinicians who've worked through this. There is a lot to do to help, you know, address these staffing shortages, but I think that it's a very solvable solution, right? And you just have to deconstruct it, and even things like, you know, looking at your material spend, you know, preference cards impact turnover time that impact efficiency in the OR, you know, looking at the holistic picture instead of trying to just solve, you know, through one thing like compensation, will help people be able to really design that better, bigger structure versus just plugging the holes.
Okay, wonderful. Well, thank you, Leslie, for your time today. It was so great speaking with you.
Yeah, thank you, Maria. It was a real pleasure. Thank you.
And to our audience, thanks for tuning in today. Look for more one-on-one episodes in the coming months by visiting our website and our social media platforms.